I will give you an explanation of each hold we will be using today and what each hold is used for. I'm going to give you a little demonstration using a pillow, and you can use this at home also, to kind of give you an idea of what the motion is like with the craniosacral system. It's not going to be as dramatic as what I'm going to show you here, but this will help you to understand kind of what's happening. If you take a pillow, you will notice if you push in and then allow the pillow to expand again, it pushes your hands out. That's kind of what's happening with the skull when you're working on it. So push in and then allow the pillow to expand. Push in, there will be some resistance, and then expand. That is kind of what you're going to be feeling with the skull. But again, it's not going to be that dramatic. It's going to be very subtle. First, I'm going to point out the suture points that we will be dealing with. You will need to know these points so that you can perform this therapy. So here we have the skull. The suture points, I'm going to give you a general indication of where they are. Obviously, we won't be able to see them perfectly because we have skin covering the actual skull. We have the frontal lobe, which is right here, which basically a suture point is going to be running through here. Then we also have the parietal lobe. We have suture points running over the top of the head and then kind of along the side and behind the head a little bit. We also then have suture points right here at the temporal lobes. And then on the back of the skull, we actually have the occipital ridge, which is right here at the bottom, and this is the occipital bone. Those are going to be the main suture points that we will be dealing with. With our hand placements, we're going to be touching lightly those suture points, and that is going to help with the release the client will experience.